Welcome to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. Today's example is a juvenile cat found as a stray with ongoing respiratory issues and now acute onset dyspnea. Once you've reviewed the radiographs using a systematic approach, then you're ready to watch this video. So here's an example of a case where, when we open the images, we can all immediately see that there's a very abnormal finding here in the caudal-dorsal thorax. So the trick in this case is to figure out where that finding is located in order to generate a suitable list of differentials. I'll begin with the lateral view. We can see that there's an increased opacity here in the caudal-dorsal thorax. I need to use both views together to determine the location. When I go to the ventrodorsal view, I see that that opacity is centered on the midline, spanning in this location here, and noted along this margin here. So although it's not quite as well defined as it is on the lateral views, based on the two views together, I would say that this feature is in a midline location. That makes me already start to think about the mediastinum more so than lung, just based on location. The next radiographic finding that we could talk about is opacity. When I look at this structure, I'm able to see more than one opacity represented. Of course, a lot of it is soft tissue opacity, but can you see how superimposed on that, in some areas, there are foci of decreased opacity, which are potentially due to gas? The next thing I want to talk about while we have this view open in particular is the concept of margination. Look at how well defined the edges of this are next to this gas opacity. This structure being so well defined on the cranial margin makes me quite certain that it's surrounded by gas and that that gas soft tissue interface is creating a clear margination. The next thing I want to talk about is the shape and the size. So if you look at the size on the left lateral view here, keep that in your mind, and I switch to the right lateral view. The lesion is not as obvious, it's in fact smaller. So this is a lesion that has a dynamic component, is located on the midline and possibly within the mediastinum. It's well margined on its cranial edge, and it has a mixed opacity. This is starting to make me think about pathology involving the esophagus because of the location. Now, let's look for other findings of esophageal disease. When I look at the cranial thorax in this case, I see reduced opacity consistent with gas, and I see a very faint opacity here, which is a summation of the esophagus and the tracheal wall, termed a tracheal stripe. The dorsal aspect of the esophageal margin is all the way up here. So on this right lateral view, I think the esophagus is large. When I go to the left lateral view that we've already been looking at, I also see signs of esophageal enlargement. Specifically, what I can see on this view is an even more pronounced tracheal stripe sign and this increased radiolucency or gas within the esophageal wall. The shape of the structure would be highly consistent because it's tubular, with being located within or involving the esophagus. So taking all these findings together, I've used the location, the opacity, the margination, and the size shape between the different views to determine that I'm quite certain that I'm dealing with a diffusely enlarged esophagus and that within the esophagus there's additional pathology. For me, this pathology is quite likely to represent an intussusception of the stomach into the caudal esophagus. This is a rare condition, but it has been reported in cats. Other possibilities could include caudal esophageal foreign material or even a mass. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.